Neurofibromatosis by Megan Brown. Neurofibromatosis is inherited by parent to offspring or by genetic mutation. This is an autosomal dominant disease. That means an affected individual has one copy of a mutant gene and one normal gene. In neurofibromatosis type 1, also known as NF1, chromosome 17 is affected. This chromosome is rich in protein and encoding protein-coding genes that affect cell growth. Neurofibromatosis type 2, also known as NF2, affects chromosome 22. This is the second smallest chromosome that contains genes that provide instructions for making proteins. The gene for NF1 is located on chromosome 17 that makes a protein called neurofibromin. This protein is responsible for keeping cells from growing out of control. NF2 is located on chromosome 22 and makes a protein called myelin, which is used to suppress tumor production. Some of the symptoms of NF1 include the presence of light brown spots in the skin, pea-sized bumps that can grow under the skin or on the nerve tissue, freckles under the armpits or groin area, tan clumps of pigmentation in the iris of the eyes, tumors along the optic nerve, scoliosis, and/or malformations of bony structures in the body. With NF1, the mutated gene found on chromosome 17 causes a loss of protein neurofibromin. Without this protein, cells are allowed to grow uncontrollably. NF2 symptoms include a tumor along the 8th cranial nerve, brain tumors, tinnitus, or ringing noises in the ear or hearing loss, spinal tumors, balance problems, or even wasting of muscles, also known as atrophy. With NF2, the mutated gene found on chromosome 22 causes the loss of protein myelin. This protein is essential to tumor suppression. It is very difficult for neurofibromatosis to be diagnosed. Often physicians rely on multiple factors to determine if a person may have this disease. At least two symptoms associated with this disease must be present. A physical exam is performed by a physician who usually orders several tests to determine proper diagnosis. An MRI, CT scan, X-ray, and genetic blood testing are some of the tests that are usually associated with diagnosing a patient. A physician will also factor in family history. The best way for this disease to be diagnosed is through prenatal genetic testing. NF1 is more common than NF2. It occurs in approximately 1 in 4,000 births. NF2 only occurs in 1 in 40,000 births. The occurrence of this disease is not specific to any race or sex. The carriers of the genes associated with neurofibromatosis often do not even know they are carriers of the gene. This is usually discovered after genetic testing is done, often with prenatal care. There is no cure for either type of neurofibromatosis. Treatment options are aimed at treating the symptoms associated with this disease. Most patients with this disease may end up having surgery or radiation therapy for tumors or orthopedic devices for malformations of bony structures. Support groups and genetic counseling is often recommended to help patients with this disease. Neurofibromatosis can be life-threatening. If symptoms are not treated properly, symptoms can be very painful for the patient. They may require pain medication to deal with the symptoms for this disease. Daily activities may become difficult. Patients with this disease may end up requiring 24-hour caregivers to function from day-to-day activities. Patients will require treatment throughout their entire lives.